What we will do in respect of everyone's time is we'll go ahead and just get started. And as folks join in, we'll introduce them because we do have a little front matter to get through around the agenda and introduction. So hopefully folks will continue joining as we move along. Today's meeting objective is to orient the members of the new Stakeholder Engagement and Communication Work Group to the National Health Security Preparedness Index structure and usage, and to the work group charge and activities. Our agenda is pretty straightforward. We're going to do a really quick welcome and introductions, and we're going to do an orientation to the index. We understand that not everyone is as familiar with the index. Some of the folks on the work group have been participating in its development for several years. Some of the folks have perhaps seen the index or even used it, but have not been directly involved in its development, and some folks may be entirely new to the index. So we want to make sure everyone is starting with a good understanding of what the index is, what it does, and how it is evolving, which moves us along to the index evolution. We'll talk a little bit about ongoing work and future steps for index development. And then we'll talk about this work group's charge. We have a very specific set of goals and activities for this work group to contribute to and to help lead as the index develops. So we certainly want to go over that and make sure that we all understand our mission, as it were. We'll talk a little bit about building a strong and useful index through stakeholder engagement, usability, and usefulness. And then we'll talk about some of the next steps around continued evaluation of usefulness, and usability, including a survey and a set of virtual focus groups we're going to be fielding this summer. And then we'll provide you with some ways of interacting with the development of the index, as well as some ways of contacting us. This is our list of engagement and communication work group members. If you are on the phone only and can't join in, I can't see what we're doing, we'll call out your name. And if you are on the phone, please introduce yourself. As you introduce yourself, if you've been involved with the index in the past, if you could take just a moment to talk a little bit about what you have done with the index or your experience with it. And if you're new to the index, perhaps you could share a little bit about what your interest is in moving the index forward. That said, I'd like to take a moment and just first off introduce Kathy Slimp, our public health consultant, who is a chair of this group and has been actively involved in it in the past. Kathy, could you talk a little bit about your experience with the index?
Sure, I'd be happy to. First, just welcome to the work group. I'm excited to work with each of you and to really utilize this work group, both to guide development moving forward of the index, and then also to help us think about how do we make sure it's as useful as it can be to the community. So my background with the index has been that I actually chaired the Stakeholder Communications and Engagement Work Group not from the very beginning of the effort, but for the last 2 years as it was being developed through CDC and ASTO and others. And so it was integrally involved in that aspect of it. And then Anna had asked if I would transition as they moved into managing the program with UK to continue to do some of that work. So I was excited to do that and see it continue to evolve, because the index is truly a product in evolution, as you will hear more about. My background is I served as the preparedness director in West Virginia at the state level for about 10 years, and then also served as our health officer. And so have a keen interest in both the intersections between preparedness and broader public health, and have also done a lot of work. I began in epidemiology, thinking about measurement, and so that's and tracking our progress, and using that for quality improvement has always been a key theme in the work that I've been interested in. So that's where I am.
Thank you, Kathy. We also have on our Stakeholder Engagement Communication Work Group this year another familiar face to the index, and that is Garrett Baker of the Association of State and Territorial Health Officials. Are you on the line there, Garrett?
Hi, actually this is Jennifer Lumpkins. I'm actually on for Garrett, and I'm actually very well in tune to the index, so I'll be on for him today.
Thank you so much for joining us, Jennifer. It's a pleasure to have you with us.
Thank you.
I think I saw Laura Biazadecki from NACHO log in. Are you there, Laura?
Yes, I'm here. Thank you very much, and I am very familiar with the index.
Terrific. Kelly DeGraff from the Corporation for National and Community Service. Are you on the line, Kelly? All right. I see that Doug Farquhar from the National Conference of State Legislatures is here. Doug, could you say a quick hello and let us know your interest in the index?
Good morning, Doug Farquhar, NCSL. Eager to learn more about the index and help us guide on a few issues that we have concerns about.
Thank you so much, Doug. Andrew Jahir with FEMA, who has been involved with the index in the past, is a member of our work group. Are you on the line, Andrew? All right, perhaps he'll join in a bit. Kathleen Kimball-Baker from the University of Minnesota, who has also been a stakeholder engagement leader. Could you say hello, Kathleen, and introduce yourself?
Sure. I'm Kathleen, and I work for the Center for Infectious Disease Research and Policy at the University of Minnesota, and was previously the director of a website that we had here called Public Health Practices. It was a compendium of practices used in emergency preparedness and response. And now I'm working on a couple of other projects, but I have been involved with the development of the index from the beginning, and first began working with the Stakeholder Engagement and Communication work group, and then gradually spent some time working with Kathy and sort of bridging some of the work that was happening with the model design group, and then eventually that group kind of became what we were calling a joint work group, and so we were working really hard to kind of merge all the different needs and communication strategies there towards the end. Last year, I served as the activity lead for the Youth and Usefulness Task Force and worked with a really fine group of individuals who were really trying to explore and get a baseline read on how the index was being used and understand, how much awareness there was of it, how much adoption or acceptance, I guess, of it, and then adoption of it in different ways. And so that was how we spent from July to December working on that. And so I am just delighted to be a part of the ongoing work on this. And that's it for me.
Thank you, Kathleen. I see Mary Langhos from CDC is on the line. Would you like to say hello, Mary, and talk a little about your connection or interest in the index?
Yes, good afternoon. Can you hear me?
Yes.
Great. Hello, everyone. Mary Langhos from CDC Public Health Preparedness and Response. I've been there since 2009. I've only just recently started getting involved with the index. I contacted Glenn Mays recently in conjunction with Preparedness and Emergency Response Research Centers, which I've served as a program official for, and we also have Hurricane Sandy Recovery Research Awards that are in the process of wrapping up right now. So I've known a number of players, including Laura and Kathleen, so it's nice to reconnect with you, and I look forward to learning more about the index and contributing as I can.
Thank you so much, Mary. Did Liam O'Fallon join us? I think he might not be joining us this afternoon.
This is Liam. I just joined.
Hi, Liam. Would you like to say a quick hello and let folks know what you do at NIEHS and how that might connect to the index?
Sure. My name is Liam O'Fallon. I'm with the National Institute of Environmental Health Sciences. I work on the Partnerships for Environmental Public Health program here, which brings together community groups with researchers in addressing local environmental health issues. And as part of that, a lot of effort is on communicating the research in effective ways for a variety of audiences, from community residents to healthcare professionals to helping to inform decision makers. And that's it.
Thanks so much, Liam. I'm so glad you were able to make it. John Osborne from the Mayo Clinic. I see John is on. Can you say a hello for us?
Certainly. Hello, everybody. My name is John Osborne. I am an operations administrator at Mayo Clinic, currently in our provider relations function, but have past operations management responsibilities for the trauma centers, level 1 trauma centers at Mayo Clinic, our trauma and acute care surgery function, and the development of the trauma region have been very involved in the development and maturation of our incident command system and our regional response activities. Have been participating in the IOM Forum on Preparedness for Catastrophic Events, where I have gotten to know Dan Hamfling, who sent me a note saying, hey, this is going on, and I gave him your name. Hope that was okay, to which I said, sounds awesome, and I'm looking forward to digging in.
Thanks so much, John. And I will say that Mary Davis is a consultant with our program management office. She will be joining us shortly. She had another meeting that she was coming from. Mary, have you gotten on the line just yet? I expect her to join us just a little bit later. I'm Anna Hoover. I'm the Deputy Director of the Program Management Office. We'll talk a little bit more about Program Management Office structure in a little bit, but it is a pleasure for me to be working with you all. I have done a lot of work around public health systems as well as environmental health and participation of communities in environmental health decision making. So it's a real pleasure to be part of this project. I think I heard a few more folks beep in, so just, is there anyone on the line who hasn't had a chance to introduce yourself yet? I believe we're going to be joined also by Emily Friedner from Homefront Communications. If Emily is not on the line just yet, she will be shortly.
I am here, actually.
Hi, Emily.
Hi, how are you? Sorry, I was on mute and I forgot. Yes, so I'm Emily Friedner for Homefront Communications, and I recently took over the project from Austin, who has left Homefront. So I'm sort of joining to help me get up to speed on everything that's going on with the project moving forward. I know we have a lot of Phase 2 activities coming up that we're excited about. So I'm just going to be listening in today and kind of getting up to speed, if that's okay.
Thank you, Emily. And for those of you who are new to working with the index since it's moved to the Robert Wood Johnson Foundation, Homefront is the communication consultant group that is working on the website and other external communication initiatives for the National Health Security Preparedness Index. So we're really glad that Emily's able to be on the call.
Thank you.
I am going to now pass the torch to our chair, Kathy Slimp, who's going to talk a little bit, give you a little bit of background and orientation for the index itself. Kathy?
Thanks, Anna. And it's just wonderful to hear the expertise that the group has. So you all will I know, be a great addition and really provide meaningful input as the project continues to grow and evolve. I thought it was important to spend a little time here on some of the guiding principles that we've had for the index, because as you, for those of you not familiar with the index is made a great deal of progress, but it is something that we always see as continuing to evolve, and we are still early in the development of the index. I think there was a decision early on that the best product would be reached if we had a very open, engaged development process in which we actually were doing a lot of back and forth with practitioners and policymakers and others as it was developed. And while that makes a messy process and a process that is challenging because you have to put it out there before you think it's perfect, it's far from perfect, but we actually have been committed to doing that, kind of living with the imperfect as we make it stronger and stronger in hopes of really developing something better than what we've had available in terms of assessing where we are in terms of our health security and our efforts in health security preparedness across the country. So in that setting, it's been very important to have some guiding principles, and in sharing these, they will help you understand, too, some of the both aspirations that we have and some of the challenges that are also realities of doing this kind of work. So So to go through these briefly, the first couple really speak to the intersectoral and the multifactorial nature of health security preparedness. And so we start with that principle that health security really does draw on many, many, many aspects of our communities and our society and our sectors, and that the responsibility for that is shared across sectors. And so those really one of the uses of the index, and we'll talk about the purposes, has been to articulate what's involved in health security preparedness and to articulate the importance of collaboration and shared responsibility, shared acceptance of that responsibility across a whole community. The index also works with kind of a broad definition of preparedness, and we want to make sure we align with existing doctrine. And so that definition of preparedness from PPD 8, really of all those things that we do as communities in advance of disasters and events that help us both weather disasters better and reduce risk and better respond, is that broad definition of preparedness. I think also, this was a principle that actually had a lot of discussion with Dan Hanfling around, and he was very instrumental in kind of thinking through this with us, is the whole emphasis on disaster risk reduction and primary prevention. We do a lot of work in preparedness sectors that are about how we respond after the fact, and there's a growing evidence and a growing emphasis worldwide around the importance of thinking about risk reduction and prevention from a primary perspective in disaster preparedness. And so we felt it was important to make sure we think through that piece as well in the index and have the index reflect and capture that aspect. And we have begun to it there, but there's more room to grow in that arena. The next three principles really were, they came out of discussions with the practitioner community very, very early on in the conceptual time period of the index, before there was any kind of an index. We were talking to them about developing such a tool, and there were some very, very core critical pieces for them. And those included that it had to be practical, had to be down to earth and practical and understandable. So we've actually to have a fairly simple model present, so that as it develops, it could be understood and practical, and then over time there may be able to incorporate some additional complexity to it. But we thought it was important to be clear and transparent in the beginning of that, and to be very practical with it, and to make sure that we added value to what's out there. We clearly don't think that we've reached where we want to be, but the index has to be better than what we currently have. And there really hasn't been anything that looks at it comprehensively in the past. And so we want to make sure that what we do is better than what we've had available, and it adds value to what people do and is useful. The next one has to do with the fact that we are using existing data sources. And we made a promise early on that for the time being we would not be asking for new data collections from folks. The practice community gets inundated with those kinds of requests, and they were clear that it really was important that we use our existing data. And so that has been both a benefit, but at the same time also a challenge, because as you know, there are areas that are really core to health security that we've not been able to really identify good measures that capture. And so that actually links to that last principle at the very bottom of the slide in terms of the ability to use the index as a call for better measurement and better science in some of our preparedness efforts. We, of course, want to align with existing capabilities and frameworks. There's been some early looking at just mapping and beginning to make sure that we can communicate the alignment with things like the public health emergency preparedness and hospital preparedness capabilities, the FEMA capabilities, the FEMA national capabilities there, the National Health Security Strategy, and now the Robert Wood Johnson Culture of Health. Those last two were kind of beginning to explore how those map and how we intersect, so that we make sure that the work that we do can fit in and align with the existing capabilities and frameworks that guide our work as a nation. The next one is clearly an aspirational principle, but we are striving to accurately and as completely as possible reflect both state and national preparedness. That is a challenge, as you know, and but it certainly is something that we aspire to doing, and we want to strengthen the ability of the index to do that continually. The next one there has to do with a transparent development process, and so we have really felt all the way through that it's critical to do this collaboratively with the preparedness community, with all those that are involved in any aspect of health security preparedness. And so to do that, we have really wanted to be very open and transparent and stakeholder driven with engagement and input throughout the process, a lot of back and forth, and grounding it in real-world experience. So as I said earlier, that makes it a messy process. It makes it an imperfect product because we want to get it out there early, but we therefore I think learn more as we go and develop it and advance it over time much better collectively than we could do otherwise. So that has been a core piece of the work done up to this point, and then UK is working on how that is continues to be a core principle moving forward. And then the last couple are just core concepts that are good to keep in mind. One is that the belief at the index is that the composite information exceeds the sum of the parts. So you'll see that there are lots of measures that are grouped into what we call subdomains, and then those are grouped into what we call domains. But the belief is that it's not the individual measures that are important. What we're trying to do is to create a collection of measures that sufficiently represent a capability or a component of our preparedness efforts, and that it's that collection of information that is more valuable than the individual sum of the parts. And so the index is not a checklist for preparedness. It does articulate the kinds and the scope of activities involved in preparedness, but its strength is really at the subdomain and domain level, because it's what it tells us collectively as we look at areas and drive discussions around it. And then finally, when you do this work, you find both large gaps in areas we'd like to have information on and we'd like to be able to measure, but we've not been able to identify existing data. And so we hope that the index becomes a call for new and better measurement around preparedness that we could then incorporate into the index over time and strengthen it. And also, we think about issues along the lines of with individual types of things we're measuring, there often is not a literature base for the target or a clear target of what would be appropriate. And so we want to utilize those where we have access to them, but we also recognize that there's very little in much of what we measure that does that. And so to the extent that we can use the index to drive that science and to drive our understanding of what's sufficient and what's best and the most effective approaches, the better. So those have kind of been key principles that ground the work that we do. So the next slide really looks at the goals of the index. And so those kind of fall out from those guiding principles as well, and you'll see they integrate. So the first one really is to increase awareness and understanding of what's involved in health security preparedness. There has been an enormous amount of resources put into preparedness as a nation, and we want to be able to articulate both what we have done to date, what's been accomplished, as well as what is remaining yet to do and what we need to sustain and to both maintain and build upon. So it's one of its goals is really to articulate the scope of efforts and activities and capabilities that are involved in advancing our health security. Secondly, it's really meant to stimulate dialogue and debate and discussion. So probably the strength of the index especially at this stage in its development, is getting communities together to really talk about, what does this say about our community? What do we think about that finding? How could it be strengthened? What makes a difference in our community? What is being looked at here that is contributing to it? What are we missing? And so stimulating the dialogue and the debate and encouraging coordination and collaboration so it really can be advanced with the concept of shared responsibility across the community. It's also really focused and aimed at planning and policy development. So we have entities that are using it to drive conversations around planning and strategic development, to think about policy implications. We are not encouraging folks to use it as the sole, the number is not an answer for resource allocation, et cetera. It is really a tool to derive the discussion that can inform policy and shape plans. Similarly, it's important to be able to use it for some quality improvement purposes and for benchmarking where we are. And as we increase the accuracy of the index over time, and as it becomes time to do validation to the extent that one can in these kinds of initiatives, that should be improving over time as well, our ability to do that, and then to ideally track progress over time. And then finally, as we spoke about earlier, that ability to drive research and development in the preparedness. So this is the current structure of the index. You'll note that across the top there, I'm going to jump to the 6 bright colored boxes across the top. Those are what we refer to as domains. So these are 6 general areas of health security preparedness capabilities that are involved. And so that's the health security surveillance, community planning and engagement, incident and information management, healthcare delivery, countermeasure management, and environmental and occupational health. And then under each of those domains, you will see subdomains. And so that breaks it down into smaller groupings or more specific capabilities under each of those. And then I'm going to go back to the structure piece a minute. Within each of those capabilities or those subdomains, that's actually where the measures fall. And so each of those subdomains has a collection of measures that are meant to, as a whole, capture where we are in each of those capabilities as both states and the nation. Now that is not, it's always that question of what's enough to do that, and so that's where I think the nuances in the development of the index come as we begin to think about how do we best capture each subdomain through that collection of measures, and then how does that work. So what happens is the measures are in the subdomains, and they roll up and create a subdomain. I'm sorry, the measures are in the subdomains, and then the measure values roll up to create a result for the subdomain. The subdomains roll up to create a value for the domain, and then the subdomains roll up to create a value for the overall index that result. Now you will see across the top it says overall, and that is actually captures a couple of things that are not yet in the actual index, but are concepts that we think are important to work in over time. So those cross-cutting bar at the top, which is again, there are no measures in that at the moment, include things like federal contributions to health security preparedness and pre-event community status, things that we think that influence our health security and are critical to it, but are not yet worked into the index. Similarly, there are, as I said, the index is always evolving, and so there are other subdomains that stakeholders and developers have thought to be critical to include in the index, but to date they have not yet identified sufficient measures. And so we think that we talk about those as grayed out subdomains, and there's several of those that are not shown on this slide, but we've typically on the website in the past and talked about more here, among those that we're developing the index with, kind of talked about as grayed out subdomains, meaning kind of the next step, what we're looking for. When we put those out there, it helps people think through what measures could we use. Let's get new ideas for measures in those. And if they're not measures, that can articulate the need to advance that science and push development of measurement in those areas. So the kinds of ones that were grayed out in the 2014 index, kind of on that radar screen for next development, if we could find sufficient measures, include things like under environmental and occupational health, responder health and safety, or environmental hazardous materials and waste management under environmental and occupational health. Under the community planning and engagement ones, there would be areas such as congregate care or fatality management that we would like to include there, but have not yet found measures to capture them. Under healthcare, it was outpatient care, and under countermeasure management, non-pharmaceutical interventions. So as you can tell, we are growing and looking to evolve as best we can over time as we identify new measures. And so the Model Development Workgroup now has been looking at what measures might we add for the 2015 index that could address either those or other areas. They're looking at some areas along the lines of cross-sector and intersectoral coordination and communication, if there's ways to work that into the index. So again, this is the work that is ongoing as to how do we strengthen and make the index stronger. And we'll use your input on there. So this is the current structure methodology. It's a very simple methodology to start with, and the UK is working to refine some of that. Currently, the 2014 index has 194 individual measures. Within each subdomain are averaged, which gives you the subdomain result. And then those subdomain results are averaged to give the domain results. And then the domains are averaged to give your overall state value. And then the state values are averaged to give the national value. So it's a very simple model at present, which has got all the blessings and the curses of simple models. And so that's where it is currently. And then I think we'll continue to evolve. The picture here is actually from the website and kind of one of the new visualizations that has taken place there through RWJF and UK's updating of things. And Anna will go into some of that a little bit later. But then the next slide actually looks at the 2014 index results. And so the national average in 2014 was about 7.5 with the range that you see there. And here it has the individual subdomain results with that. But the results can be looked at on the website both at the national level and the state level. And you can drill it down into overall results, domain results, subdomain results, and individual measure level results at the state level. And again, that's really to provide those tools to drive dialogue and discussion and to strengthen our preparedness efforts. So I'm going to turn it over to Anna here to talk more about where UK is taking it and how it's continuing to evolve.
Thanks so much, Kathy. As I think we mentioned earlier, in January of this year, management of the index moved to the Robert Wood Johnson Foundation, and we at the University of Kentucky are the program management office for that effort with our partners at Homefront. Emily introduced herself a little bit earlier, managing the website and some of the external communications in conjunction with the program management office and the RWJF communications staff. So this is just another view of the website, another way of looking at the national overview. And what I was hoping to show you here is that we have the domains or action areas, broader action areas are sort of laid out here with the national scores. And then you can see this is the map that Kathy was referring to earlier, and this is a little bit of a heat map. Right now, as Kathy noted, the methodologists and the model group are looking at ways to refine the index. They're looking at a number of issues that I'll address in just a moment. So it's very difficult to say exactly how For example, an 8.4 differs from an 8.2 until a lot of that validation work and scaling and weighting work happens. So what we've done here is working with Homefront and RWJF, created a little bit of a heat map to show the highly performing states and the states that perhaps have a little more room for improvement. And that's how this heat map breaks down right now. But again, it's a very small variance there between an 8.4 and a 6.5 when you're not quite sure what a tenth means at this point in terms of overall preparedness. We have here, I just was going to show you a little bit about how you can drill down to the state level, and we're using Kentucky as the guinea pig here because well, I'm here. So we have here the Kentucky results, and you can see that the preparedness result is sort of on par with the national result, and you can see the action areas there, the domains and action areas. And we have added, one of the things we have added this year to the website is just a little bit of narrative around each state that talks about the tertiles and where a state ranks in terms of the top, mid, or lower tertile. This was again, a new addition to the explanatory material on the website, so we'll be interested in hearing from you all and from others if this is a useful way of thinking about the index results or not. We're going to be checking in on a lot of different issues around how we're communicating the index, both through the website and through other mechanisms. So we'll talk a little bit more about that in a couple of moments. I hate to be breezing through this, but we're 40 minutes in, and so I want to try to get as much through as much as we can. You can see here that on the Kentucky State Summary, you again have these larger action areas. And you can see that you can then drill down within each of those subdomains into specific measure level findings. So that was just a quick view of how you can drill down there. One of the first big changes in the index evolution for 2014 we've mentioned several times, and that is the move of the index from the management through the Oak Ridge Associated Universities in partnership with CDC and ASTO and a number of the partners who have really led this effort to date to the Robert Wood Johnson Foundation, and we are keeping all of those folks closely engaged through work groups and through our National Advisory Committee. So the folks who have developed it are still very much involved in the process. But the management and leadership of the program management has moved to RWJF and us at UK with, again, our partners at Homefront. And you can see here this little organizational map that tells you a little bit about how this goes. So we have RWJF, and then we have a National Advisory Committee, and I'll tell you a bit about who's on that in a couple of moments. And then our National Program Management Office works with the National Advisory Committee, RWJF, and Homefront. And we have brought in partners from across the University of Kentucky to assist with that effort, as well as from outside the University of Kentucky. We have Glenn Mays, the director of the Program Management Office, is the director of the National Coordinating Center for Public Health Services and Systems Research, and I am his deputy director in that initiative as well. So we bring to the table through that initiative partnerships with practice-based research networks in public health in more than 30 states, as well as a network of researchers and partners interested in public health systems and service delivery research. Our Program Management Office Program Manager, Michael Childress, is with the University of Kentucky Center for Business and Economic Research, and we also have partnered with the UK Division of Risk Sciences and Timothy Selnow to help lead this effort through our Program Management Office. We have a couple of consultants working closely with us, Mary Davis, and I'm not sure if Mary has made it on the line yet or not, but Mary is very experienced public health consultant and particularly experienced in conducting focus groups and evaluation work, which is what we are going to be doing as a work group for a while now, I think. And we also have Chris Nelson from RAND working closely with us, and he's leading the work of the model work group. And you can see here the three work groups. We have our Stakeholder Engagement Communication work group, and what we're going to be looking at primarily, our real focus is going to be about the messages, particularly as the methodology becomes refined, We're going to be looking at how to message to specific groups. We're going to be looking at the uses. How is the index being used? How could it be used? And why is there a gap between those two things? We'll be talking a little bit about what tools we might be able to use the index to develop visualizations or decision support tools and applications that we might be able to develop through the index. We also, again, have the model design work group, and that is led by Chris Nelson of RAND as the chair. And they are looking at the frameworks, the alignment with frameworks that Kathy mentioned earlier, as well as the domains or action areas, the specific constructs and the indicators. And then we have the methodology and analysis work group led by Chris Bollinger from the Center for Business and Economic Research, which is looking at some key issues around scaling, weighting, validation, comparisons, trending, and visualizations. This is our National Advisory Committee. As with this Stakeholder Engagement and Communication Work Group and all the work group, we have tried to keep involved, heavily involved, the folks who have been so key in developing this, even as we expand the tent, so to speak, or try to expand the tent to bring in some additional stakeholder groups. So Tom Inglesby, the chair of the National Advisory Committee, has been involved in this effort since the beginning and was the steering committee chair prior to the move to RWJF leadership. We also have Bob Burhans, an emergency management consultant from New York, who was also involved in the index development from the beginning. Also on that advisory committee, the National Advisory Committee, are Anita Chandra from RAND, Anna Maria Jones from Collaborating Agencies Responding to Disasters, Eric Kleinenberg from NYU, Jeff Levy from the Trust for America's Health, Assistant Secretary for Preparedness and Response, Nicole Lurie, Stephanie Lynch, a Louisiana Parish Commissioner, Suzette McKinney from the Chicago Department of Public Health, Stephen Redd from CDC OPHPR, Richard Reed from the American Red Cross, Martin Jose Sepulveda from IBM, Claudia Thompson from NIH, NIEHS, and John Weisman, who is the Washington State Secretary of Health. So we have tried to bring together state and local public health, business interests, nonprofits, a wide variety of initiatives through the National Advisory Committee, as well as through the makeup of the work groups. As you can tell from this group, we have a very diverse group of stakeholders at the table, and that is by design, to make sure we're getting a variety of perspectives. Some of the ways that the index communications are evolving, we've alluded to earlier, including this redesigned website, which is at www.nhspi.org. And we also have a call for measures that is sort of a standing call. We issued a push for it back in February and gave a deadline of about a month for folks to suggest new measures to be included in this year's index. But we have a button on the website at all times asking folks to suggest measures through this online interface to make sure that we have an opportunity for folks to reach out to us at any time when they come across a measure and they think, this would be a great thing to have. In terms of some of the methodological refinements that Kathy was alluding to earlier, some of the things we're looking at this year through the methods work group, through the models work group, and we actually had a day-long National Advisory Committee meeting earlier this month in DC, at which we talked through some of these issues, are consolidating and simplifying the overall index set of measures. As Kathy mentioned, we have 194 individual measures, some of which are grouped into sort of composite measures to equal 170, don't quote me, 3-ish, I think. So we're looking at what measures might be correlated, redundant, or noisy. We're also looking at the breadth and composition of the index by looking for new measures, specifically in some of those areas that Kathy mentioned earlier around social, environmental, and economic indicators of preparedness and resiliency. We're also continuing to work on index alignment. As Kathy mentioned earlier, that has been a guiding principle of the index from day one. And as new initiatives come online, like the culture of health, or as the National Health Security Strategy continues moving forward, we're looking at always strengthening those alignments and making sure that we are doing work and providing information that is complementary without necessarily being redundant. So that is some of the major work of the models work group. The methods and models work groups are also looking at improving the methods used for scaling individual measures to reflect distributional properties. They're looking at enabling more accurate comparisons across state and over time. As Kathy mentioned, the index is a wonderful tool, and it has aggregated a lot of information that previously had not been aggregated. But one of the challenges to developing in the public eye is that it's not really trendable right now. So we are trying to figure out how to get to the point where we can say accurately that if the index changes over this amount of time, then there really has been some change. So we're looking at those kinds of issues. Also looking at improving methods for grouping and weighting individual measures. As Kathy outlined in the current structure, you have the individual measures. The more measures in a subdomain, the less each measure counts in that domain, as you know, or the more subdomains in a domain, the less subdomains matter. So we're looking for how to better align those both scientifically, mathematically, and from a theory-supported standpoint in regard to should certain measures matter more than others, and make conscious decisions about those kinds of issues. And to that end, we'll be fielding a Delphi survey later this summer around some measures, and we'll talk about that probably a little more on the next call, because that is in very early development. The methods and models work group and our biostatisticians on the program management office are working around creating that Delphi survey to get some real expert input into some of these measures and where they fit on the continuum of preparedness impact. And we're also looking at incorporating these analytic methods that will allow us to trend better than we can right now. And one thing we hear sometimes, I know we heard earlier this year that folks are already starting to, some decision makers are already starting to look at the index from year to year and think of it in terms of trending, and it's just not there yet. This is the timeline for some of the work that I just laid out in terms of methodological changes to the index and methodological evolution, and then we'll really start, as we get a firmer sense of what some of those changes may be, we as a group will start hammering out some ideas around messaging and how are we going to communicate some of these changes around methodology or changes in domains or measures. And we'll certainly get there in just probably about 3 months. I expect we'll have a much better sense of exactly what we're going to be working around. We have, in the meantime, been talking for the last 7-8 months about the index in some meaningful ways, in some meaningful settings, including the 2014 index launch where Kathy spoke with Tom Inglesby and I believe Bob Burhans and some other folks at the Capitol, which came in December of last year. And this year, since the transition to the Robert Wood Johnson Foundation, our PMO staff have had conversations with ASTO, NACHO. You can see here we've had conversations at CDC and done presentations for those folks. I think Mary is on the line, and Mary Lanehos is on the line. She attended at least one, maybe two of those. We have we did a panel with the Preparedness Summit. Kathy was a part of that, as well as Jim Blumenstock from ASTO, who has been a real leader in the index development, as well as Alonzo Plow, Vice President for Research Evaluation and Learning at CDC, and our partners from Mississippi, Jim Craig. So we've been doing a lot of those kinds of presentations, trying to tee up, this is where the index is, and these are the kinds of changes that may be coming down the pipe. And to that end, we also have a presentation next month at the Council of State Governments Midwest Regional Meeting. So that gets us to the work group, and I've talked around this, but I think if there's one thing we need to walk away from this call with, it's the work group charge, and it was in the invitation letter, so this should look pretty familiar to you all. What we're going to be doing is helping to identify and target potential end users of the index. Who is this information important to, and how can they use it, and what messages do we need to be sending them? Not just to promote the index, but also to learn from them how the index can be refined in ways to make it more useful in their world. So we're going to be contributing to the development of tailored messages and materials for those groups and helping identify the best channels for reaching those groups. Again, the index started by design with the recognition that health security is a multifactorial arena, and they had to start, we have to start where we can, and where we started was with public health and then starting to move into healthcare as well. But we're looking with the Robert Johnson Foundation and the Culture of Health Initiative as well to start thinking about other sectors that intersect with health security preparedness and start really trying to open up the tent for those folks to come in as well and benefit, whether they be community-based organizations, whether they be local businesses, but thinking really from a 1,000-point view of who we can bring to the table in these conversations. Who can we benefit and whose knowledge of health security, particularly around some of those issues that Kathy was talking about earlier, like pre-event community status, who really has a voice in that and who really can be a strong partner in this work. We're also going to be working to ask you folks on the committee to help react to existing index measures and to the plans for the continuing refinement. So as we get more of a direct sense of what is where we are going methodologically, and if certain measures may be considered for how strong they are, if they are, to what extent they are considered to be contributing strongly to the index, if those are discussions we need to have, if we need we need to have some discussions with this group to react to, well, is this measure important, even though maybe it's only collected every 3 or 4 years. So we'll have those kinds of discussions. We'll also work together to identify where are the knowledge gaps and what are some of the potential uses of the index to help fill those knowledge gaps. We'll be asking you all to recommend additional data sources and measures and materials. One of the things about bringing new people in is you have new perspectives and new experiential knowledge, so they can be so that you can share with us. Perhaps there are measure data set, or that perhaps there are data sets that have measures that will be very valuable for this, and we're just not familiar with them because those are not they're not in our background, perhaps. So would love for you all to be thinking about those kinds of things. And then informing the development of processes and activities for collecting input and feedback from these end users and potential end users. So we'll be talking about data collection, talking about how we analyze data, about the use, usefulness, and usability, and how well we're communicating about the index. So that's essentially this work group's charge. We are down to 5 minutes, so I'm going to just kind of power through this really quickly. This is a slide about who the index is for, and this is, you can see some of the early major target audiences were around emergency management, public health, legislative staff, community groups, healthcare, city and regulatory planners, and more. And in that more, that's what we're thinking about now are folks in business, folks leading consortia, those kinds of groups. Building a strong and useful index.
Anna?
Yes.
Anna, this is Kathy. I'm wondering actually, I feel like you all, the group has gotten a really good background here, and clearly stakeholders are a critical and important piece with index development. This slide I think you've got on right now captures a lot of the components that they've inputted to this date. I'm wondering if it might be good to put up the usefulness piece to a next conference call, and maybe let Kathleen speak to some of those. And then maybe just open up for discussion now a little bit about some reactions from the work group or questions or areas that, now that you've heard your charge, you would really like to make sure we address collectively. And then let's close out with the next steps that Anna could give some specifics. Is that what do you think about opening it up for that now, and then putting the usefulness off to next time, and then closing out with next steps?
I think that sounds great. Where would you, do you have a slide number you would like me to point to?
Nope, I'd let's stop to next steps. But before you even get there, I'd say let's open it up to the group. Any reactions, thoughts, questions, things that you'd like to get on the table to make sure that we thinking about in our planning together as a work group.
This is John Osborne. It would be useful to understand, as we're looking at identifying stakeholders, on the web page, it has the past year's team listed, which represents a different group of organizations and seems to reflect a greater federal level of interest than the new structure. It would be useful to kind of get a sense of who some of the key players have been in the past, and of those groups and organizations like Joint Commission, Hospital Association, and some of the federal groups that don't have active roles or have moved into different roles, just to kind of understand how those relationships have evolved so that we're not looking at a slide and saying, oh, wow, this person should be there, without understanding there's history and context as to, yep, they are there because they're behind the scenes or they've moved in this direction. So getting some background on who has been engaged from a stakeholder perspective and how that has changed over the past couple of years, I think would be useful to set some base expectations around the types of uses and the types of audiences for future.
Super. So kind of mapping past organizational engagement and where that fits in today.
Yes.
And how it's expanding.
Yeah, exactly.
Great. Great. Thank you. That's super, John.
Kathy, this is Jennifer Lumpkins, actually, and I wanted to bring up, and this is something that has come up several times in the last couple of weeks through various meetings. A lot of the state health agencies and a lot of the preparedness directors have indicated that they really haven't had much engagement since the rollout last December. I would encourage that trying to get them involved as early as possible, recognizing I know that you're still working on a lot of the different measures, and ASSA would be honored to help facilitate those types of discussions. So let me give you some opportunities that you can engage this group. So we have the DPHP Executive Committee, which is comprised of 16 individuals that represent the various preparedness directors around the country through a regional structure. We also have, every other month, we have the Directors of Public Health Preparedness conference calls. We have moved to an every other month schedule, and the next call is not scheduled till August. The other opportunity would be an in-person opportunity, and I would definitely encourage and would be happy to help you work on this and to get on the agenda, is our Directors of Public Health Preparedness annual meeting, which is actually October 27th through the 29th in Glendale, Arizona. Typically in the past, for the past several years, there's always been a panel to talk about the index, the various things that are different, and how the various stakeholders can be involved. And that's also an opportunity to have that in-person dialogue with them. So those are just some of the things that I wanted to raise, because when I asked a few of the preparedness directors a couple weeks ago at another meeting, they don't have this on their radar anymore. So we would be happy, and I know Garrett would be happy to help facilitate that. And I can do that too.
That's great, Jennifer. We actually had a conversation about that on a call a couple weeks ago, and that's great feedback for UK, and that would be super if you could help us do those and kind of get those on
Absolutely.
the
Feel free to reach out to me. I would be happy to connect you through our various calls and then our in-person opportunity. So reach out to me as much as you need to.
Super. Thank you. Other thoughts, ideas?
So right offhand, this is Liam O'Fallon, NIEHS. In terms of making the connection with, there's a disaster research response group project that is being led by Aubrey Miller within the National Institute of Environmental Health Sciences. I don't know if you had contact with that particular group, but it just at that, it would be a particular audience to engage with as well. And I'm happy to sort of state that if it hasn't already taken place.
I'm wondering if folks, because we're getting lots of good ideas about groups to reach out to, and I'm wondering if you could send those, Anna, what's best, to you, to me, to however you'd like best to do it.
If you have additional thoughts after the call, please feel free to email it to me at anna.hoover@uky.edu. And Liam, that's a great suggestion. I actually sit on that group. I wasn't on last week's call. I think it was last week because I was away, but that's a great group, and I absolutely see us making some important connections there. So thank you for that, and thank you, Jennifer, for the terrific suggestions about the upcoming ASTO opportunities.
Great.
I know we're almost out. Actually, I know we're a minute out of time, so I want to be respectful of folks' time, but I do want to point to something we are going to be asking of you very shortly. And something that John mentioned is very interesting, because I think that what he was talking about has to do with specifically with how some things are presented on the website. And we are in the process of, well, we're in the alpha stage, really, of developing a use, usability, and usefulness survey. We have entered it in REDCap, and we are pre-testing it with our some of our internal leadership and RWJF and Homefront. And this, it looks at how folks are using, if they are using, and how they are using the index, as well as specifically some of the issues around website interface. Since we did launch a new website this year, we think it's very important to assess how well that is communicating some key information about the index. So we are going to be asking this group to beta test that, and to really take that opportunity to think about whether you've used the index, how you could use the index, and then look at the website and think about it, if there are things we could be doing better, if there are things that you really like, and please share those with us. That's a more structured way to get some feedback around the website through this beta testing. But also, as you finish that up, if there are some specific issues you want to address with us, or you want us to put on the agenda that you experience as you're thinking through those issues, please also send us an email. We're hoping to put together some focus groups later this summer to really delve into some of the issues that might arise through the survey, as well as some other issues. So we'll be doing data collection all summer around the survey, and then hopefully starting to get into those focus groups soon. So in hopes of having a report to Homefront in September to really help with the development of the 2015 index online platform. You know, I know you heard Emily mention at the beginning of the call phase 2, and that's phase 2 of website development that is currently, well, it launched around June 1st, so there are some bells and whistles and some things that are coming down the pike about the website in the near future. But in the meantime, we'd like to look at where we are and what we're doing well and what we can do better. So that sort of covers the next steps there. Kathy, did you have anything that you wanted to add before we need to let the folks go?
So when will folks probably get an email about piloting the survey?
My goal is to have an email about piloting the survey out before the holiday on the 4th. We've asked for feedback from our internal sort of pre-test group by the end of the day on Friday, and hopefully we'll have Monday to make any tweaks, and then get something out next week, early to middle of next week.
That sounds good. And then so this group, and then broader, we work through this group to get some broader input on that survey subsequently after once the pilot is tested, is my understanding. And that'll really be the first feedback we've gotten on the new website. So that can really be helpful to your input, and those that you can link us to will be really, really helpful to shape further development of that website, and to think about how the index is visualized, and the tools that are developed for the index for the next year. So that'd be great. That'll be super to engage you guys in doing that. And then Anna has the last piece here on the slide, which talks about our next work group, where we're on the schedules for the 4th Tuesdays of the month, with our next meeting being July 28th. So, and you are welcome to also listen in on any of the other work groups meetings that occur, and those are listed there as well, and there's a way to find those on the website as well. But I just want to say thanks to the group for joining us today. I look forward to working with everyone, and it's a nice opportunity to really continue and build on stakeholder engagement. So thank you to all. Anna, anything else that you've got?
I just look forward to hearing from everyone. Again, as you have thoughts about any of the issues we've discussed, please feel free to shoot us an email or just give me a call. We're happy to set up a side call if there's something you want to discuss before the next meeting, or if you have an agenda item. I think we'll spend a lot of time on the next call talking more about the survey that will be in the field by then, hopefully, as well as the focus group protocol development and where we are with that, and hearing from you guys what you think we need to be asking. So as you go through that survey, in addition to answering the questions, think about what we might be missing. So thank you so much. Have a great day. We really appreciate you being part of this, and we look forward to working with you over the next year.
Thanks so much.
Thank you.
Thank you.
Bye-bye.